I'm Ryan Hampton. I'm the organizing director at the Recovery Advocacy Project, also a person in long-term recovery. I like to also identify more importantly, as important at least as my recovery status. I'm a community member, I'm a voter, I'm a taxpayer. I am getting married in, a couple of months, which is something I never thought possible. Dog lover, son, brother, advocate. These are all things, that my recovery and my own personal recovery journey of what I define that as, have allowed me in the last couple of years. And I'm super grateful to be able to virtually just kind of join the great state of Texas tonight and kick off this amazing town hall, which is a culmination of a lot of work over the last year. The Recovery Advocacy Project really launched in earnest in 2019, mid 2019, as a result of Mobilize Recovery, which some of you may have heard of. And I always like to kind of share our mission statement. We are a network of people and organizations, grassroots organizations, authentic organizations across the country, embedded in states that are advocating for addiction recovery policies. Our guiding principle is that we believe that by being committed to giving people in recovery, family members and supporters, if we give them the grassroots organizing tools to think and act locally, that they can make impact and sustainable change. And we're working hard to build a visible and effective constituency of consequence that's in demand of community and public policy-based solutions to our longstanding addiction crisis here or across the country. And for me tonight, here in the state of Texas. And I just want to welcome you all and thank you. And I think it's important for us to note that the work that we're doing now and the work that we'll do in this legislation and beyond could never be more important. Overdose numbers have risen significantly as a result of COVID. People are searching for a sense of belonging. I can say in my own personal recovery, this last year has been the most difficult challenge to me ever. And I'm a person who can identify with some privilege. And I believe that a lot of people are being left behind. This last year's work through Texas, the Texas team in RAP, and some of the legislative priorities you'll hear tonight are the result of 3 listening sessions, really the beginning of a conversation that were held in the state of Texas. One that was Spanish speaking. This is where these legislative priorities started. They crossed the continuum, the recovery continuum, including harm reduction, criminal justice, treatment, family members that are involved, people that are impacted, allies. It has been a lot of work, and I'm excited to see how we move ahead. And I just want to close by sharing a quick story before I turn it over to our moderator tonight, Carl Hunter. A couple of weeks ago, I think all of us are used to, sadly, receiving phone calls and messages from community members and people that we love and family members, and learning about people that are close to us and members of our community. And I had that experience a couple of weeks ago from a mom of a good friend of mine who I actually lived in a house with and was one of my roommates when I entered my own personal recovery journey in 2016. And I kind of knew what was going to be revealed to me when I called her back. I just had that gut feeling. And I was prepared to hear, Mark had overdosed. And she shared with me that it wasn't an overdose, that Mark had kind of on and off been trying to find his own personal pathway. And he was kind of had some time in sobriety and, was using drugs and, in other parts of his journey. But this particular time frame when he passed away, it wasn't an overdose that killed him. She said he had committed suicide, and he was living in an apartment by himself, had lost his job about 6 months prior, had lost the connection to his community. He was unable to access any type of recovery support service, any type of harm reduction support service, and he essentially had given up. And Mark's story had a tremendous impact on me because it reminded me that the work we were doing prior COVID is going to be twice, 3 times, 4 times as hard as we're walking out of this COVID crisis. And we need to be doubling down on our efforts. So I am grateful to every single one of you and for joining in this work and being a part of this tonight. And I just want to remind you that because we don't, and some of us may, and there's nothing wrong with that, because we need all of you, and we need everybody to be a part of this. But if you don't have the alphabet soup next to your name, like I don't, it does not mean that your voice is any less valid or important, and quite frankly, is sometimes even more important than those that may have those, alphabet soup following them. Your lived experience, what you're seeing on the ground, what you experience, that's what your legislators need to hear. They need to hear from you, and they need to hear from what you need in your community, because we are a diverse community. And if what we have been doing was working, we would not be where we're at today. And I'll just remind us all that the overdose and suicide numbers were definitely on the rise pre-COVID. COVID just added another wrench into the works. So with that, thank you. Thank you for your commitment to this cause. Thank you for making this your passion. Thank you for taking the time out tonight. You can learn more about us at recoveryvoices.com. As soon as COVID passes, I can't wait to get down to Texas and meet many of you in person. And with that, and with an extraordinary amount of gratitude, I will turn this over to Carl Hunter, our moderator for tonight. Carl? Carl might be muted.
Dude, you guys missed my intro.
There you are, my man.
Hey, Ryan, thank you for sharing. You talked about having alphabets behind your name. I do, but crack and heroin is no respecters of degrees, So my name is Carl Hunter. I am the senior policy advisor for the Recovery Advocacy, the Recovery Coalition of Texas. And I'm being moderator for tonight. And my job is to keep everybody on time. Could you please put that person on mute? Thank you. And so, we're going to go through our agenda this evening. And the first part of our agenda is legislators speaking to the recovery community. During last legislative session, I had the opportunity of working with both of these legislators, and they are both champions for the recovery community. So without further ado, I'm going to give you Representative Ina Manjarrez. She's from District 124 in San Antonio. Representative Manjarrez, the floor is yours.
Good evening, everyone. I'm so excited to be here, and thank you all for what you do and the passion you have for this serious issue. I want to thank Carl and Robin, who've worked with my office on this piece of legislation that I'm going to talk to you about. But before I get into the weeds of this particular bill, I just kind of also wanted to talk about why recovery and substance abuse is just so important to me. I am a daughter of a father who has struggled all of his life with addiction, and through the years have seen how hard it had been on him and also on my sister, myself, and my mother, but recognizing at the time the lack of resources. But there came a time in 1993 when I was graduating from high school that he entered a recovery center. And that seemed to have been the godsend that he needed. And I am happy to say that he has been sober since 1993. And because of that, we have remained a family. So this is a very, very important area for me because I know so much needs to be done to ensure that we give the help and the resources needed. So this particular bill is HB 544, and it's focused specifically on recovery housing. Believe it or not, there are bad actors where recovery housing is concerned. There's a lot of places that set up shop with the title but don't necessarily provide the services that are needed and don't follow evidence-based methods. And as a result, the people who go there suffer. So under my bill, we provide a solid definition of what recovering housing means in statute. There's no current definition for recovery housing. This bill would also instruct the Health and Human Services Commission to adopt standards that are consistent with nationally recognized standards and recognize one or more credentialing organizations to develop and administer a voluntary certification program. This bill is really important because it protects a vulnerable population and it promotes cost-effective outcomes for individuals in recovery from substance use disorder. It offers training and technical assistance to certified recovery homes to be managed by trained administrators, ensuring a designated person is responsible for knowing and upholding laws, ethics, and standards. This bill adds Chapter 469 to the Health and Safety Code and establishes credentialing organization requirements, including application, certification, recertification, and disciplinary procedures, training requirements, and a code of ethics. 30 plus more states have already implemented recovering housing certification. The National Alliance of Recovery Residences already has an affiliate in Texas offering certification. So HB 544 would strengthen the fair housing rights of residents in certified recovery housing. It would also prohibit engaging in patient brokering or kickbacks and from using false, misleading, or deceptive marketing. So I just believe that this bill, which I have the help of another representative, Andy Murr, he's a Republican out of the Kerrville area, which is not too far from San Antonio. He has always believed in this bill from last session. So he's joining me as a joint author in this bill and helping me do the heavy lifting. But essentially what we want to make sure is we're protecting the consumer, we're protecting the people from bad actors out there. And hopefully this will definitely be a safeguard to ensure that those recovering housings that are doing the right thing continue their good work in the state of Texas.
Oh, I'm unmuted again. Thank you so much. Could you speak a little bit more about the bad actors?
Sure. So when the Affordable Care Act was implemented, as well as the Mental Health Parity and Addiction Equity Act of 2008, these are great pieces of legislation. However, it created loopholes for people just to set up shop, right? So a lot of people who wanted to create businesses with money on their mind, just more about profit, not really knowing how these recovery centers work, not having the training, not understanding the ethics involved, they set up shop everywhere. And, you know, when the representative I mentioned talked about having a large number of these bad actors in Kerrville. So they set up shop and they're not giving true treatment to people needing it. They take advantage. Sometimes if it's not a good environment, the person does not know where to go to complain, right? Where do they go and file a complaint if they're in a recovery center that's not doing what they're supposed to do? And a lot of times are afraid to speak up because they're afraid, number one, they're gonna lose their housing, which will cause a chain effect of them losing their job, just bad one thing after another. So unfortunately, they're just bad actors in this world, but in this particular field, it's just about setting up shop under the guise of recovery center. We're going to help you. We have the housing, but they're truly not good actors here.
So your bill would also not only provide the certification in making the recovery owner follow a level of best practices, but it would also at the end protect the end user, protect them from bad things happening to them. You know, there's stories about what happened in Florida, and we're trying to stop some of that from happening in Texas, where those in Florida have been put in jail for the things that they did for people that were trying to recover. So, so Representative, we thank you for your time. Do you have anything else to say? Any other bills you want us to know about?
No, this is really my baby here, and I was happy that I could talk to you all about it. I know we couldn't get it done last session, but hopefully we will have an opportunity to get it through. And if any of you want to reach out to my office, please do so. We really love hearing from people and you know, hearing about the good or the bad, but we love feedback from everybody, and even ideas as to what we can do to make better. But I definitely hope that you enjoy. I understand my colleague, Representative Joe Moody, is here, and I really hope you get to enjoy his presentation, because he's an incredible legislator.
Well, we thank you for coming, and thank you for taking the time out of your busy schedule to hang out with us.
Oh, thank you all.
Thank you so much.
Thank you.
Bye-bye. Next up is that we have Representative Joe Moody, and Representative Moody is also a champion for people in recovery. So now I give you Representative Joe Moody from District 78 in El Paso.
Hey, thank you so much. I appreciate it. Can you hear me okay?
We can.
Okay. Sorry, I had to check. I actually just landed back in El Paso. Got back from Austin today, so I apologize for not being on the video, but I'm grateful to have the opportunity to join with you. And I always love hearing from my fellow El Pasoan, Representative Mijares. And so we, you know, El Paso's got a small delegation, but we've got other members that are from El Paso that were infiltrating other delegations to spread El Paso's leadership across the state. So I appreciate her kind words, and obviously her work in this arena is very personal for her. You know, I came at this policy arena a little bit different track. I started my legal career as a prosecutor, and in that world, when you're a young prosecutor, they talk about you see people that have substance issues, addiction issues, and it may be a myriad of other things that layer on top of that. And the solution we've had for a very long time is to simply criminalize that behavior and not treat it as a healthcare issue, but treat it as a criminal justice issue. And that was just the way we've done things. And quite honestly, when we find a complex issue in society, whether it be homelessness or mental illness or substance use issues, we, rather than really roll our sleeves up and solve the core problems, the root problems, we just say, lock these people up. Lock these people up. That's the easiest solution. We'll just create, we'll just create a warehouse for these folks, and we'll treat them as, we'll just treat them as something other than ourselves, and kind of extricate ourselves from their problems. And as a young prosecutor, you don't really think deeply about those things until you start really learning the stories of folks who are struggling and trying to better their lives, but get wrapped up in a myriad of problems and get derailed. And so recovery for me, and I appreciate everybody sharing their stories earlier. Recovery for me is making sure that we continue to treat people like human beings, and making sure that we realize that we all falter, we all fail, we all have struggles in many ways. But that doesn't mean that we throw somebody away. And so recovery for me is that, and that's why I've tried to find some space to work in the policy arena on this. I've got a couple of bills I'm happy to talk about on recovery housing, and also being able to pull down funds for peer-to-peer services, peer-to-peer counseling services, which are provided by RCOs across the state. Those are the two bills that really hit directly on recovery that I'm carrying. But certainly want to thank y'all for doing this and putting these, putting people in, even if a virtual room, but putting people in the room together to talk about these issues, because as was mentioned earlier, while these problems weren't created by the pandemic, they have certainly been amplified by it. And I don't want to call, I got to be careful, I don't want to call this a silver lining, but I think there are people who found it very easy to ignore this issue. Substance use was something, and recovery was something, and addiction was something that we could ignore unless it was directly impacting our lives. We could you choose to ignore it and put it away. I think that because of the way we have had to be, be in closer quarters with one another, maybe those struggles are a little bit more pronounced. Maybe people now know how pervasive some of these problems are, and that their loved ones are struggling in a way that maybe they weren't aware of before. And so I think this is one of those issues that, while it didn't just surface in 2020, maybe people have a new appreciation and recognition for how important it is that we focus on it. And so to that end, this group knows very well that peer-to-peer counseling services are things that RCOs do very well. They know how to follow national best practices. And the term peer-to-peer became a buzzword in the last several years as people started to turn towards alternatives to incarceration, looking at treatment options and recovery options. And in the process, we have not allowed for RCOs to be able to pull down Medicaid dollars to serve folks of lesser means that have these same issues. And the truth be told, the RCOs provide these services better than most. They know how to do this. And so why, the begs the question why we don't allow them to pull those funds down. So HB 705 would allow that to happen. And it's certainly something that we filed it last session, and we're going to continue to work on it this session. Sometimes these take time. HB 707 is the other one, which looks at expanding recovery housing in the state of Texas. And while we know that we have shortage of bed space, and that's always a challenge, and sometimes it's very difficult to expand that, expand that in the short term, what that bill does is it creates some data that HHSC is going to gather for us, telling us where the problems are with shortage and recovery bed space. And then let's use that data to then come back in a future session and really put our money where our mouth is. So this builds the foundation to be able to expand recovery space in Texas. So those are two that we're working on diligently, and look forward to continue to work with this organization and others and advocates across the state to promote. That being said, I'm certainly happy to answer any questions or discuss any other legislation that's out there. And I'm just, again, grateful for the opportunity to be with y'all.
Well, Representative Moody, I just want to thank you. 707 was HB 1465 last session. And I was able to take it all the way to the Senate. And hopefully this year, during this session, we'll be able to take it through the goal line. And so I just thank you for your diligence and all that you've done for the recovery community, and all that and providing a safe place for me during last session that I can come and hang out at and chocolate and rest my feet and make copies. So just thank you so much.
Absolutely. No, it's we all got to pull in the same direction to get some of these things done, because we know that none of these tasks are easy. Even just studying the topic is not an easy task for some people. And I'll tell you why. It's because some people don't want to know the answer to that question. Because once you have the answer to that question, it's going to demand more action. And so I look forward to that journey with you this session. I think I look forward to getting that on the governor's desk for a signature this time around.
Well, thank you so much for your time. We know you're just getting off of a plane. We don't want to monopolize your time. Is there anything else that you'd like to add? If not, we just thank you, and we appreciate you taking the time out of your busy schedule to hang out with us. No,
thank you all, and thanks for continuing to be amazing advocates in this space, and I look forward to continuing to work with you and amplifying your voices into the legislature.
Thank you, sir.
So much.
All right. Have a great day.
Have a nice day on purpose. So moving right along, folks, we are moving into, we're going to talk about the legislative landscape. So over the next 45 minutes, we're going to have a number of speakers. We're going to start with Robin Peaston. She is the Executive Director of the Recovery Coalition of Texas, and she's going to talk about recovery support services. Robin.
Hi, everyone. Thanks for being here. It's great to see so many faces I recognize, and it's also great to see faces and names of people that are maybe new to these and to these advocacy activities. So again, thanks. So this has been a wonderful opportunity to collaborate with the Recovery Advocacy Project. It's been kind of a match made in heaven to make these meetings possible, and with the Action Network. So let me tell you a little bit about the Recovery Coalition of Texas. Our mission is to advocate for the recovery movement and support individuals and organizations engaged in peer-based recovery supports and services. And our vision is a future where recovery is fully supported, valued, and celebrated, and available to all who seek it. So we're in an organization whose focus is on advocacy and education. And this is our first town hall, and we work closely with the Texas team of the Recovery Advocacy Project, and Garrett and Aaron have been wonderful in helping us. And having a chance to hold a town hall and focus on legislative issues during a legislative session and develop our platform, and then look at, what are our recommendations and what are the bills that align with this platform. And so this town hall is focusing on those bills, and we'll be following up with some action alerts and, working towards supporting active advocacy. So you'll know bill numbers if you're interested in housing. You'll know bill numbers if you're interested in expanding recovery supports and services. And then we'll be working towards providing ongoing support. The bill that the RCT is focused on is the bill that Representative Moody discussed. So I'm not going to go over that, but just we are very much hoping to be successful this year in getting a definition of recovery community organizations into legislation, and getting recovery community organizations added as a provider type for Medicaid. We've got a lot to cover. I'm not going to use up much more time, and I'm going to pass it back to Carl so he can move it along to our next partner in this town hall.
Hi, hey everybody, I'm back. Thank you, Robin, for your insight. We're on our schedule. We have Christy Mulcree and Richard Bradshaw. I hope I didn't mess up your last name, Christy. And they're going to talk. They're both from the Harm Reduction Alliance, and they're going to talk about harm reduction. Christy, you're first.
Hi, thanks, Carl. And you totally got my last name right, which was awesome. So definitely appreciate that. I'm Christy Mulcree. I am on the legislative work group with the Texas Harm Reduction Alliance, and I'm a previous board member of the Austin Harm Reduction Coalition here in Austin, which is our syringe exchange program. And for those of you who don't really know anything about harm reduction is a set of principles and strategies aimed at reducing the consequences associated with drug use. And it's also a movement for social justice built on the belief in and the respect for the rights of people who use drugs. And harm reduction recognizes that the realities of poverty, class, racism, social isolation, past trauma, sex-based discrimination, and other inequalities affect both people's vulnerability to and capacity for effectively dealing with drug-related harm. And so moving into some of the bills that we have that we're working on is HB 1178, which is from Representative Crockett's office in Dallas. And we can't really talk about, prohibition and the war on drugs without talking about racism. And what this bill would do would be to decriminalize possession of paraphernalia, which police officers use paraphernalia as probable cause to search people. And this would also decriminalize people who participate in syringe exchange programs. And then moving on, we have another one with Representative Moody's office, which is HB 3233. And this specifically would authorize syringe service programs in certain counties. So this would allow people to participate in the syringe exchange, and it would also allow for funding in certain counties. And this was last filed in 2015. And lastly, we have our Good Samaritan bill, which is filed in the Senate with Senator Eckhart. And I want it to be known that this bill was vetoed by the governor in 2015 after it unanimously passed on both sides. And so it was not a bipartisan issue. It was completely the governor having issue with the bill itself. And right now there's a bill in the House and in the Senate filed by Rainey and Schwartner. And the reason why we aren't really supporting that particular bill is that it includes 4 separate requirements in order to qualify for a defense of prosecution. And the Good Samaritan law would allow for people to call in an overdose without being prosecuted. And this would allow for more people to get access to treatment if they need to. And it would also allow for data to be collected in the state. And states who have enacted a Good Samaritan law have seen opioid-related deaths decrease by as much as 15% without an increase in drug use. And with the Rainey-Shortner bill, previous convictions would exclude the people at highest risk of overdose and result in a lot of missed opportunities to connect people with treatment. So those are some of our bills, and I just wanted to pass it over to Richard to speak a little bit further.
All right, my name is Richard Bradshaw, and I am the operator of Central Texas Harm Reduction, and I'm also a member of Texas Harm Reduction Alliance. And some of the things that I kind of want to talk about is to take a look at some of the ideas and the negative ideas that are potentiated by some of the policies that are already in place, and how these go forth and moving. Moody talked about it too. Talked about treating people like humans, and some of these bills that are introduced, like always like to keep in mind that we're not necessarily reinventing the wheel here in Texas. There's states across the nation that have adopted these policies, and they've received not only healthcare cost savings at a state level, but they've also received like overwhelming positive health outcomes from people who face substance use. We see a decrease in incarceration, and we see a lot more money that can move towards other things aside from incarceration and treating HIV and hepatitis C, which is really the outcome of a lot of the policies that we have in place in Texas. A lot of disease epidemics that are going on in regards to hepatitis and HIV are kind of fueled by these policies, and they just potentiate it, but also in potentiating the harm that they do to people who use drugs currently, they also potentiate stigma towards people who use drugs currently and formerly as well. And so approaching it from the standpoint of like treating people like they're human and providing them with care and for resources. And Moody talked about, and so did Minhara. She talked about what's going on the front lines. And what's going on the front lines is unprecedented overdoses, and it's peer or family members that are reversing them. And these overdoses are going unreported out of fear of prosecution for calling 911 for an EMS to come. So not only is the data not getting collected, but the individuals are being forced to go without medical care after just having a catastrophic health event. And this is something that could be put in place and certain areas too, is not only does 911 respond, but they'll take them to the hospital, medically evaluate them, and then refer them to the next step of getting better. And what we see in these cases, in these circumstances, a lot of this stuff goes unreported, and people continue to go untreated. And to kind of wrap all of it together and how this kind of fits into recovery is supporting health for people and adopting the idea that and not just the idea, but the definition that SAMHSA has given us, and improving people's wellness and their health, and recognizing too that doesn't necessarily have to start at complete abstinence. We can start improving people's health and improving their health outcomes while engaged in use. And other states have woken up to this. A lot of other countries have woken up to this, and they've adopted these policies, and it's turned out really well for them. And so I forgot when I introduced myself, I'm a member of Recovery Advocacy Project as well. And like one of the things that we want to do is like bring some of this stuff into the forefront of the people and the public and garner support. Because the other states where these bills have gotten passed, like they did so with voices just like ours, just like the people that are on this call. They started doing the necessary things. They started reaching out to the representatives, the legislators, throughout, since like y'all be receiving emails and stuff from RAP and from Action Network and all that for any kind of actions that you support. So participating in that and sharing that on a social media platform and just kind of watching that unfold exponentially, and it'll have a lot of momentum, and change is possible. We're in the middle of like I referenced earlier, unprecedented overdose crisis. At our harm reduction agency in Waco, we recorded 20 overdoses in one month. And that was the month of November 2020. And out of those 20, every single one was a peer or a family member reversing, and none of those individuals received medical care afterwards because 911 was not called and it went unreported. So that's a lot of these bills are just moving towards fostering positive health for people, period. Using drugs, not using drugs. It's a win-win on all sides. And we just wanted to kind of bring that to the forefront of y'all, and to kind of have people be aware of things like that. And also to a lot of these bills, especially in regards to the syringe service programs or SSPs that would be piloted by counties, and then combining that with a bill that would decriminalize possession of paraphernalia, so participants of the exchange couldn't be prosecuted as well. These are things that the majority of other states are doing. And they're adopting them. And it's also a CDC recommendation, which has been put out around the end of last year. CDC put out a recommendation that states adopt that and adopt pilot programs. So there's a lot of evidence behind it. And part of what we're doing here is just kind of developing a voice for our state so that we can push through for policies to be adopted that make sense. And yeah, that's it. So I'll hand it back to Carl. Thank y'all so much for having us, and thank you for everybody who came to this. And I'm very grateful to be here, and I'm grateful to be here with all y'all.
Well, don't leave yet.
Oh, thanks.
Don't go. Like Christy and Richard, you know, when I first started doing what I do, I had a problem making the bridge between harm reduction and recovery. Could you speak a little bit more about that?
Sure. So when we talk about drug use happens in a continuum. You know, abstinence being on one side and chaotic drug use, or what we call addiction, on the other. And there's an array in between. And so I think sometimes when people think about or hear the word harm reduction, it's like we're condoning drug use. We're saying that it's okay and all this stuff. And what we're saying is that people have the right to choose what they do with their body. And as they do that, they have rights and autonomy because they live and breathe. So just because someone decides that they're going to use drugs doesn't mean that you know, those human rights of housing, of healthcare is taken away from them. And so kind of going back to what Richard was saying about, you know, the SAMHSA definition of recovery as being, you know, this holistic betterment of your life, you know, harm reduction enables people to continue to have healthy existences. You know, it helps with the spread of communicable diseases. It allows people to stay alive. You know, there is no recovery if someone's dead.
I like that last part, and I like the most important thing is respecting people's humanity, but respect their humanity and don't let them die, right? Mm-hmm. Because then there's a chance to do the other thing. So we appreciate the work that you do, and we thank you guys for hanging out with us. And now I have to move on. I got to introduce the next person, but the next person is me. Hey, right? So I'd like to introduce you guys to Carl Hunter, right? I know him personally. He's a really good guy, right? And I'll tell you guys a story. During last legislative session, I had the opportunity to present before the Select Committee on Opioid and Substance Use Disorder. But 300 days before, I was sitting in rehab, right? And, you know, I wish I could go back and tell that guy, dude, you have no idea what's going to happen to your life after you decide to stop using drugs, right? Because you can't recover something that you never had. So recovery for me means that I'm just becoming the person I was always meant to be. And that person ended up standing for like a crackhead from New Jersey. Think about that, right? And during last session, I got to work on, my focus was recovery housing. And I got to focus on 3 bills, and 3 of these bills are coming back. HB 292 was, and HB 544 were both combined with 1465, which is my bill. And then there was 1658, which is another bill. And what we have to understand is that we're playing the long game. Not necessarily when we introduce a piece of legislation that it's going to go through on the first time. So what you see happening this session is that these bills are coming back, and now they have a better chance of becoming laws in the state of Texas. If you don't know, there were over 7,500 bills that were filed last session. Only 1,227 of those bills became law. So there's real work involved, and your voices mean something. You know, we go into certain rooms and they tell us we have to be anonymous, right? But we get clean. Well, you can tell where I come from, right? When we get clean, right? We're expected to go back into the mainstream of life where our voices count. So you all being here today, I want you to tell you that your voice counts. So now I'm going to move on to the next person, and that is Greg Hash. He is the executive director of NAMI Texas, and he's going to talk about equitable access. Greg.
Hey, everyone. Yeah, good evening. How are you? Great to see you. Greg Hansch, Executive Director of NAMI Texas. This is a tough act to follow. Carl's amazing. It's really an honor to work with him and his organization. We have had the opportunity to collaborate in the past, and we're doing so once again. Boy, do we have a great MC for this event tonight. I'd like to jump right into providing you with a few updates on bills that NAMI Texas is involved with that I thought might be of interest to you. The first one is around parity. I know some folks will be familiar with parity. This is HB 2595 by Representative Price. As I'm sure folks are aware, many individuals with mental health and substance use disorders encounter insurance treatment limitations that sometimes don't even exist for medical surgical conditions or are applied differently for medical surgical conditions. In one survey, 1/3 of respondents reported that they or their family members had been denied mental health or substance use disorder care on the basis of medical necessity. And that's more than twice the percentage who have been denied general medical care. And there are stats like that all over the place. We know that insurance companies treat mental health and substance use disorder differently than the way that they treat medical surgical conditions. There was a bill passed in 2017 here that was intended to establish and ensure fairness in the insurance context for consumers of healthcare services. And that bill required health insurance companies operating in the state to provide coverage for mental health conditions and substance use disorders equal to the coverage that they provide for medical surgical conditions. And that very concept is referred to as parity. Despite the passage of that bill, the promise of parity has not been fully realized in our state. Disparities exist. And I'm sure there are folks on here who have seen this play out in the real world, where let's say a person is authorized for residential treatment, but then has to leave the residential facility a lot sooner than would be optimal because the insurance company won't pay for it anymore. Would that be the case for a person who had a heart attack or was on dialysis? No, those folks would get longer stays in their facilities. So the HB 10 should level the playing field, but it hasn't come to its full implementation. So we have a bill filed that would educate people on their existing rights, and there would be an awareness campaign so that everyone knows what their rights and responsibilities are when it comes to parity. The bill would designate October as Mental Health and Substance Use Disorder Parity Awareness Month. And it would improve the processes by which people have the ability to file complaints if they believe their parity rights have been violated. And I hope everyone here in Texas is aware that the Behavioral Health Ombudsman at HHSC exists for the specific purpose of taking complaints from folks like us who have been subjected to or who have family members who have been subjected to unfair denials by insurance companies. That's a good existing resource that more people need to be aware of. I also just wanted to call attention to a couple more bills, one of which is around access to medications in criminal justice facilities. And I know the next speaker, Maggie, who's amazing, is going to be addressing topics around the criminal justice system. One specific issue that we're interested in is ensuring that people who had access to a medication before they entered a county jail are able to keep access to that medication. And, you know, I think that applies to the substance use disorder context in a couple of different ways. One of which, let's just say specifically, is for substance use disorder medications themselves. It's my understanding that substance use disorder medications are not very well utilized in the criminal justice system. The vast majority of jails and prisons do not offer this treatment. But what if someone was on that treatment before they entered the criminal justice facility? Shouldn't they be able to keep access to it? And that's what our bill is intended to address. So that's SB 944 by Senator Eckhart. Lastly, and briefly, we have a bill related, this is almost like a combination of the first two bills. This is about ensuring that insurance companies don't give people the runaround on accessing their medications. Insurance companies will commonly approve a medication for a person, and that's a great thing. A person's been through an arduous journey to find the right medication, but then the insurance company down the road will increase the out-of-pocket cost of that medication. They'll put in place a prior authorization requirement. They might even remove the medication from their prescription drug formulary entirely. And that, as you might imagine, for people with a wide range of chronic conditions, I would say including substance use disorder, can be extremely problematic and damaging to their overall health. And it's also bad for the healthcare system itself and the economy. So this bill would require, if a person is on a medication, it's been approved by their health insurance plan, and they keep the same health insurance plan going from, let's say, 2021 to 2022, they're able to keep access to that same medication. Their insurance company can't remove access to it. So that bill is HB 1646, and the companion bill is SB 1142 by Senator Zaffarini and Representative Lambert. So those were the bills that I wanted to, just touch on. We appreciate any support that we can get. Feel free to reach out. Again, Greg Hanch with NAMI Texas, and we really appreciate the opportunity to collaborate with the Recovery Coalition of Texas and its partners. Thanks again for having me.
Greg, thank you for coming.
Thank you, Greg.
Fellow brother from New Jersey? Yes. Jersey and
shout out.
Right. Thank you for coming, Greg, and we appreciate your time and your effort and all that you do. Next up is Maggie Luna. Maggie's a fellow, a HOG fellow, and my friend. And she's going to talk about criminal justice and reentry. Maggie is with the Texas Criminal Justice Coalition. Maggie, we welcome you.
Thank you, Carl, and Greg, and everyone who's spoken so far. I mean, I'm just like so honored to be able to be here with you guys. So my name is Maggie. I work with the Texas Criminal Justice Coalition. I'm the HOG fellow. I also am the co-founder of the Statewide Leadership Council, which is a project of the Texas Criminal Justice Coalition. We are formerly incarcerated advocates or advocates who have family members who are incarcerated. And we are working on a legislative agenda that hopefully we can get some of our criminal justice and reentry legislation through. And so one of the things that is most important in our statewide leadership council is parole. We have several people who have been incarcerated and not offered programming, such as, they'll be 9 years in, and then all of a sudden the Board of Pardons and Parole says, okay, now you need drug treatment, which 9 years into your sentence, you don't have the same traumas that you had whenever you first got there. It's probably more compounded, and you need a different treatment plan. So last year we spent $1 billion denying people parole and for them to wait on their next parole date. The bill that we are recommending is House Bill 2793. Representative Jarvis Johnson has filed it. This would provide the incarcerated individual with a copy of their individual treatment plan within 45 days of intake. It would place the people directly into the rehabilitative programming that they need, especially the programming that is only accessible right now through the Board of Pardons and Paroles. And it would be eligible prior to their first parole eligibility date. And this would allow the Rehabilitative Programs Division of TDCJ to be responsible to provide a report to the Board of Pardons and Paroles, communicating that, yes, this person has been doing this, this, and this, and then the Board of Pardons and Parole can base their decision on the rehabilitative process. So, you know, we're calling it the common sense parole reform because it seems like it should work that way, but it's not working that way. And we noticed during, whenever COVID hit, there were a lot of people incarcerated waiting on programming who've been there years. And if we lost some family members waiting on programming. They had been approved for parole, but they got COVID and passed. So that is one of our major focuses this session is House Bill 2793. We're also working along with the Clean Slate Initiative, the National Clean Slate Initiative. You may have heard all over the nation, people are passing progressive expungement bills, helping people clear up their records. And so we have teamed up with the National Clean Slate Initiative, and it's a whole package of bills. Hopefully, if we have all of these out there, a few of them will pass. So our three main goals are automating expunction. There's people who are eligible for expunction right now at this very moment, but cannot afford it or do not know that they are eligible. So, and in order for you to be eligible for expunction at this time, you have to be not guilty. And so then you have to hire an attorney and go through this lengthy process. And this stops you from getting housing, employment. It's a barrier that is unnecessary. So we are hoping to get the expunction process automated. Our second component would be to expand that eligibility to misdemeanors and low-level convictions. Now, most of the people on the Statewide Leadership Council would not qualify for any of this because, like myself, I am formerly incarcerated. I was released in 2017 for a crime that I did commit that was drug-related. I had drugs on me and I served my time, but this less than a gram charge will follow me for the rest of my life. I will never get to apply for a job and not be able to tell them I had this felony. So we said that, you know, the Statewide Leadership Council would no sooner grow wings than be eligible for these expunctions that are there now. So we have introduced a piece of legislation called New Wings. It would give us, people like me, that have been convicted, have done their time, and are on a path to recovery, a chance, a pathway to non-disclosure, and just give us new wings. So that piece of legislation is being filed by Dr. Alma Allen. I do not have a bill number for that yet, but we do have House Bill 45 by Representative Jarvis Johnson, which would expand access to first-time non-violent felony convictions. It would require a 2-year waiting period for probation, 3 years if you serve time. It would shorten a waiting period for serious misdemeanors from 2 years to 180 days, and shorten the waiting period from felony from 5 years to 1 year. So that's House Bill 45, and then the New Wings being filed by Dr. Alma Allen is going to be a heavy lift. So like Carl said, you know, sometimes it takes a few sessions, and we are prepared to continue this fight as long as possible, because nobody should have to carry that for the rest of their lives. I see stories every single day. If you just had $3,000, you could clear your record, and for something minor. So it's ridiculous, and people are they're feeling defeated when they come out from prison, because I'm never going to get a house. I'm never going to get a job. I'm never get, you know, and that's exactly how I felt when I got out. I never in a million years thought that my past would be what drives me today and what helps me to do what I do. And so I'm very grateful. And I wish everybody had the same chance. And so the last bill that I'm going to talk about is House Bill 1394 by Representative James White. And this would expand the eligibility offenses to include misdemeanors other than fine-only traffic offenses. It would include convictions that are not followed by probation. It would apply to any eligible person who completed a sentence on supervision before September 1st, 2014. And it does not restrict first-time offenses, but it does require a 7-year waiting period. So that's House Bill 1394. And like I said, there's a whole slate of bills out there for Clean Slate. If you're interested in learning more, we have the Clean Slate Initiative website. You can go to texascjc.org and look up the Statewide Leadership Council and see all of our legislative initiatives. We also have a webinar tomorrow at noon. So, I mean, there's a lot of people out there really fighting for this, because Clean Slate is so important, and it's happening all over the nation. In Washington, they have passed a law that once you're finished and you've completed your term after a couple of years, your civil rights are completely restored. And I mean, Texas is like the 48th state to ever do anything. So hopefully we'll get somewhere close to that. So that's my spiel. Thank you.
Hey, Maggie, thank you for coming. Do me a favor. Put your information in chat so people can see it. Because there's at least one other person, right? Because of their drug use, they caught a charge, right? Yeah. And I would say there's more than one, right? And so, you know, moving, and I also want you to talk about, right? Because this is your first session, right? And you're an advocate, so you did a lot of protesting, but there's a difference between protest and shaping policy. Could you talk a little bit about that?
Yes, I do a lot of protesting in the personal capacity. So, right, and when it comes to shaping policy, it has been definitely an adventure and a learning process, because to me, what seems to me like common sense, because just of the humanity, it is amazing when you walk in to talk to somebody who's never been hit with addiction, who's never been touched by the system, and they don't understand the inhumanity of what happens behind bars. And also, as an addict, the inhumanity that I put myself through, you know? And so one of the things about shaping policy that has been most difficult for me is just talking to people about, yes, I committed a crime, and yes, I've done my time, but at some point, shouldn't that be done? You know? And so it's just really, messaging is very important. Getting that message out there that I'm not asking you to just let me go free if I've done something. Help me to be accountable to myself. And, you know, one thing I love to tell them is that we don't all get life sentences. We do come home, and we will be your neighbors were your workers or your waitresses, or, you know, and what kind of person do you want us to be when we do come home? And so messaging in the policy realm is very, very important for me right now. And I'm really grateful that some doors are opening and people are starting to see the humanity, but it's slow and it's a process.
So Maggie, two more things and I'm gonna let you go, right? You and I were both peer policy fellows, right? And the value that they found in us was that we had lived experience, right? Everybody else went to school and whatever, but we kind of went to the school of hard knocks. So could you talk about the importance of your lived experience and how that has shaped some of your public testimony?
And, you know, that was one thing that I was trying to touch on, is that when I first got out of prison in 2017, December 2018, exactly 1 year later, I was standing in the Capitol for the very first time in my life. And it was amazing. I never in a million years thought that my prison experience and my drug addiction, my 20 years of smoking meth and heroin and all of that was going to be my asset today. And so what I've noticed with the Statewide Leadership Council and all of these people who are formerly incarcerated and fighting for change, when we walk into these offices with these legislators, they hear numbers and stats all day long. And they're just like, okay, here, give me your paper, and that's it. But when we walk in and we tell them what really happened and how it really feels in there and what it's like to gasp for breath because you cannot breathe in this hot cell and you're not going anywhere, when you tell them what it's really like, that's whenever they start to open their eyes and say, wait, does that really happen? Are people really eating food that looks like these pictures that I'm getting? Yes, that's really happening. So the importance of us telling people what is reality, people like us with lived experience walking in there and saying, yes, this is happening. And we're getting people, their hearts are changing. Maybe not everyone, but you know, you get a different reaction whenever you come in with reality and organic, real experiences. And so it's just something that I am, in a million years, never thought that I'd be sitting right here. And I'm forever grateful that God allowed me one more chance and didn't let me die out there. And I'm so grateful to be here and with all of you. Thank you.
Maggie, thank you for your time and thank you for all that you're doing, the new work that you're doing. And so we're going to move on. We have one more person that we're going to kind of like draft. His name is Joe Powell, and Joe Powell is the executive director of APA. And Joe, you're going to have to help me with the acronym because I don't remember it. I did too many drugs and I still haven't gotten my 5 years yet, so I don't have my brain back yet, right? So I'm going to introduce to you guys Joe Powell, and Joe has a long and celebrated, I won't say past, but I'll say present, because not only is he doing his thing on a state level, but he's doing stuff nationally and internationally. So I give it to you guys, Joe Powell.
Thank you. My name is Joe Powell. I'm a young person in long-term recovery. And what that means, 32 years now without a drink, and wow, and any opiates since 73. And it's only because of recovery that I'm able to be an advocate today, a person, a lifelong learner, a servant leader, and a father and a husband, and president and CEO of APA, Association of Persons Affected by Addiction, also on the board for the Recovery Council Coalition of Texas. And I'm on a lot. And I'm just going to just say, I just came off of a NADAC committee on critical issues in the Black community. So I'm doing a lot of stuff nationally because of DEI, right? Diversity, equity, and inclusion, and how do we really move that along with this? And there's a lot of legislative stuff. I'm on it. Sherry Layton is on here too. She helped me to get on that committee meeting I just left. But also just to say that you know, whereas today we had one of the recovery organizations in Connecticut was testifying to Congress because they're one of the states that parole cannot vote if you're on parole. And so, I mean, there is a lot of issues and challenges. I think here in Texas, there's so much that's going on. I'm here to learn. I think that I'm just excited that I can make it from these other committees and these other meetings to be here with you. And so hopefully that I can use whatever connections or whatever I have to move also all of us toward health, wellness, and recovery for our community, for the state of Texas. And I'm just honored to be here. Thanks, Sal. Carl Hunter, there, and it's always excited to be around Carl Hunter. Thanks, Carl. And Rob Jason.
Thanks for the plug. Folks, we have come to the end of this session, and I'm going to leave the final words to Robin, and to, we're going to leave the final words to Robin. Robin, you're up.
I want to just say thank you to everybody who made presentations, and to Representative Moody and Minharis and the work they're doing. You know, I remember when I first started doing this work, and I was really intimidated. Walking into the Capitol, you know, I was like finding my way around, going in and knocking on doors and, you know, introducing myself when I'd never done anything like that before, starting from scratch, actually when I was with NAMI and NAMI Texas way back when, and then with Communities for Recovery in Austin. But here's what I learned. You know, addiction is such, it's touched so many people, you know, and I could go in as a family member in recovery and speak to people, and I would just say who I am. I'm, you know, so-and-so, I'm with the Communities for Recovery. We help people with peers and substance use. And I'm telling you, 9 out of 10 times, there'd be someone in the staff who'd like sit up and look and go, I want to talk to you, because in their lives, you know, then they would sit down and say, oh, well, let's talk policy. And then we go to a room and they'd say, you know, my husband, my brother, my sister, my mom, my son, my daughter, you know, they died of an overdose. They're out there using, you know, they're out there drinking, you know. And so because this is an illness that touches so many lives, and there's so much struggle and pain, you know, and having someone who's just willing to listen, you know, and then start talking about policy. So it's really person to person, people to people. You know, we won't be in COVID forever, and we'll be able to go back and share our stories and talk about our experiences. And, you know, our voices have power, guys. People listen to us because we speak from our experience. Sometimes we speak from our pain, from our frustration, from our loss, from our success. You know, it's not all bad. You know, I did this program once with judges, and they were like, you know, all they'd ever seen in court is, you know, the worst cases. And so being the message that recovery happens, that I'm a person in recovery, and here's what that looks like. So sharing all of that, that's powerful with legislators and policymakers. They stop and listen. I've heard, you know, a pin drop in a committee room, you know, where there's 100 people listening and they're all talking, and then the person in recovery gets up and starts talking, and everybody listens. So our voices have power. And what we want to do with the Recovery Advocacy Project and the Recovery Coalition of Texas is unite our voices. We have common cause. And, you know, legislators actually count how many letters did they get for, and how many letters did they get against? How many calls did they get for a bill, and how many calls did they get against? And, you know, the staff is reporting to the legislator, the representative, here's how many for, here's how many against. You're making that call, you're sending that letter. that's revolutionary. You do have a voice. It does make a difference. And so, you know, our next steps are going to be sending out some action alerts. If you registered for this, you're going to be getting those action alerts. When you registered, you indicated particular areas of interest. You know, so you may say, I'm really interested in harm reduction. We're not going to inundate you. Don't worry about that. You know, I'm interested in criminal justice. I'm interested. So we're going to try and make sure you get those action alerts that you're interested in. I know, guys, we covered a lot of ground. We threw bill numbers at you, and some of you may like, holy mackerel, is that what they were doing here tonight? Well, kind of, yes, that is what we were doing. But we're going to have other town halls down the road. You know, we're going to be planning that with our recovery advocacy project, our Texas team. You know, this is grassroots. And that's where the power is, to get us all, find our recovery voice and then speak up, and we can shape policy. You know, what Richard said and what Maggie said, there are other states who are passing legislation about safe syringes. They're passing legislation about decriminalizing. They're passing legislation about regulating housing. They're passing legislation about recovery community organizations being on a provider list so we can get paid by Medicaid to deliver services that we started in the first place. Shout out to Joe Powell, shout out to Ben Bass. You know, Recovery Alliance and APA, they were started in like 1994. We're the ones who brought recovery to Texas and communities for recovery. So, and those other states, they're doing that legislation. And so and they're doing that because the voices of recovery count. Our voices count. And we just want to help make it easier to give you the information you need to take those actions. That's what we're here for.
Thank you, Robin.
You're welcome, Carl.
I've given Robin the name Mama Bear. She's really, really happy. Mama Bear is happy. And we just thank each and every one of you for coming and supporting our first effort. Stay tuned for what happens next. You know, divided we fall. Together we stand, divided we fall. And our voices count. If you don't leave away with anything else tonight, understand that our voices count. And if we put our voices together, we can be heard and make a difference. So everybody have a nice evening on purpose. Thank you.
Thanks for coming.
Oh, nice seeing you again.
Hey, whoever's still listening, I just want to make a quick comment. A lot of people, I didn't know this until I moved to Texas, but like recovery, so much of getting a bill into law in Texas is persistence, right? Because most people don't realize a legislative session in the state of Texas is every other year for 180 days. That's it. So what'd you say, Carl? 7,500 bills, and they passed what, 1,000 or so. So I mean, that's not much time. 180 days, even 1,000 is astonishing that it got passed into law. So I mean, they really don't have much time when they're in session to address this issue. So the more we can be proactive the whole year and through for those rest of the non-180 days, those 180 days will make more of a difference when we're present, right?
Yes, sir.
And this is just the start. You know, as Carl said, we're here for the long run. You know, right. Persistence in the, you know, over the next, you know, the session lasts through May unless the governor calls a special session, which is another conversation. And right. COVID has made a huge difference, but, you know, we'll be back in 2 years, guys, you know, and what we don't get accomplished now, we'll get accomplished then. We're never going away. They better get used to it.
That's correct.
All right. Thanks, everyone.
Thank you, everybody. Good night, Father George.
Thank you, Robin.
Thank
Carl.
you, Robin.
Thank
you, Shanice. Thank
Carl.
you, Ben.
Bye-bye. God bless everybody.
Bye, Father George.
Bye. Thank you so much.
Thank you,
From
Father.
Miami.
Hey.